will you feel if you know you have cancer?
Bad news.
Yeah.
Which is the worst ever personality disorder?
It's a wrong question.
Just because of this resistance, they don't want to go to the expert. Good day to all watching. My name is Tariq. I'm your host. I have with me Dr. Safiya, a well-renowned psychiatrist, medical director of Mind and Brain Hospital. Today we are going to discuss about a very profound topic, which is personality. I think there is a huge confusion about English definition and psychiatric or psychological definition. I want you to break it down in a simpler language. What is personality?
Generally, when we talk about personality, the first thing they think about is the person, the way they look or something, the height or
Yeah,
that's what they think. Oh, good personality or something. So that's a common language usage. But then, when from a psychiatric perspective, when we talk about personality, we're talking about the ingrained nature of the individual, like ingrained predisposition or the way they kind of understand the perspectives they have. So by definition, personality would be an ingrained behavior of an individual.
so do they have, for example, if somebody falls in the category of X, so does it mean that there are some peculiar traits associated with any personality?
See, there's personality and there's a personality disorder. They're
Yeah.
two different things. So every one of us, like the way we have our color of skin or the way our hair is or the eyes are, it's unique for that individual. Similarly, personality is unique for that individual. So all of us carry a personality that would reflect in our attitudes, our preferences, choices we make. So that is an inclination a person has, an alignment that person has. So calling it a disorder is a different lens altogether. But personality, everybody has, it's very commonly said that you're an introvert or an extrovert. You are somebody who is neurotic. There are a lot of terms which is being used to kind of define personality, which that comes in a general term, which is not an illness per se. It is the nature you are having, the attributes that you're having. But then it could be a disorder when it becomes a problem.
Okay, does that mean having personality is not a problem, but if it is this, how do we basically differentiate?
Personality is not a problem. It's like how you have a color, you have
Okay.
a personality.
Okay.
So it's not like that person has a person. That's a personality of a person. Like you kind of say, okay, this person is a very extrovert person, or this person is a very friendly person, or this person is a very quiet person. So the kind of nature they have overall, that's personality.
So okay, if you have to count these personalities on the fingertips, what are the major types of personalities?
There are different things which we speak about. Some people are very open. Openness is there. They are very easy to talk to. There are some people who take their time. They're a little bit drawn. Some people are very agreeable. They can kind of tell yes to everything. Some people they take more time. Some people are novelty seeking. They would want to go on a high and seeking sensations. Some people are different. So the choices they make depends upon the kind of personality you have. So there are different variations in that. So that way we could categorize them.
Can we change?
It depends upon whether like there is personality development courses, right?
Yeah.
So what do they do?
Uh-huh.
So it depends. Like we by nature may be very comfortable with something. Like by nature, I may be somebody who would like to do something. Maybe that may be interfering in my progress. Like let's say I'm somebody who takes decisions quickly. So if that is a problem for me and it is not allowing me to make the right decisions, and I have to groom my decision making style, then that becomes my personality development area. So we definitely can change.
Okay, I mean, so before we delve a little deeper, there has been a lot of celebrity talk, like Princess Diana, and it seems that like they were suffering. I don't know if that is the correct term. BPD, bipolar, borderline disorder.
Personality, yeah.
So there has been childhood trauma which has been associated with it. How true is that?
So for a personality to be called as a disorder, that itself is a big label. we need to be careful about that. So when does any personality become a problem? Let's say you have a particular height, and when does that become a problem? Or you have a
If it is
particular,
too much.
yeah, it is too much, it is interfering in your life, right? Similarly, a personality also, all of us have our style of personality, and if any of it becomes a problem in our decision making or the choices we make or the way we perceive life, and it interferes or adds on to existing mental health problem, then that's called as a disorder. Otherwise, it's not called a disorder. So for and all of us, that's a very loosely used term nowadays, so which we should be extremely careful about. So before we call anything a disorder, we need to say how much order it has. So disorder is when we have lost it, and then it kind of significantly impairs that person's functionality. And borderline personality is spoken a lot about in media, especially Western media, and also now in Indian media context, it's being used a lot. Borderline personality, so it's one of the serious conditions which people do suffer a lot with: impulsivity, abandonment issue with intense relationships, self-harm tendencies. So there's a lot of characteristic features of a borderline personality which we should be respectful about.
Okay. Now, what I'm actually intrigued by, if a person knows his personality, then if there are any, obviously there will be some pros and cons. Now, there is one extreme wherein, okay, he's trying to correct his bad negative traits, and he's trying to become a good person. As you said, like there are some courses also. Now there is another extreme wherein now it has become so, people have become so vocal about it. Now they loosely,
Use
kind
the
of
term,
labeling
yes,
themselves as this. So how do we kind of balance this? Because this is actually, absorbing that effect of the whole topic.
So disorder and order has a lot of difference, and it's very obvious if someone has a disorder. Uh, there will be patterned behaviors. You do the same mistake again and again, or you kind of get into same patterns again and again. There's a pattern in the behavior and the kind of consequences they have. There is a kind of particular style in the way they are presented, not only in one setting. It's not like a person having, let's say, an uncastric personality, not only in one setting. I'm not having that behavior in one setting, I'm having it in more than one setting. I'm the same in my workplace, I'm same at home, I'm same in my outside. So that particular nature of mine is interfering in everything. Let's say I'm getting easily irritated, so I'm going to show that behavior everywhere, and that's significantly impairing me, and that is showing a pattern or a period of time, and that becomes an obvious for that individual that this is your problem. So that's where the disorder comes into picture. It's not it happened once and then I call it a disorder. No, it has to have a pattern over a period of time in multiple settings.
Okay, is there a set protocol for diagnosis?
Yes, we do have a lot of assessments which talks about personality, and the different types of disorders that are there. When we talk about an ancastic personality, where they have a lot of perfectionism, rigidity; borderline personality with a lot of impulsivity. There's a intense emotional reactions to everything; dependency, where you're too dependent on somebody, you're not able to have your own independent decision making; paranoid, suspicious all the time. So there are different variations in that which needs a clinical diagnosis.
Medications?
Personality disorders do not help with medication, because first of all, to have an insight that you have a personality disorder takes some time, because most of them are in denial that they
What is the acceptance rate?
very poor.
I think that's a bigger problem.
That's a very big problem, because that individual has lived that way, and they think that that's the world.
Is the normal
that's
way.
world. That's the world. For them to see that that's not what it is, and there's a blind spot to it, and you have to now rewire yourself to think a different way. It takes a long time, and the success rate completely depends upon how well they accept and are ready for a change.
Whatever we had discussion into a simpler language wherein it can resonate with our audience.
So the way things are perceived, for example, let's say success. For many of us, if it is good enough, we're happy. For some, it has to be like 100%. Something less than 100% seems invalid. So For somebody who is having a perfectionism as their attribute or the personality, anything less than 100% becomes the problem. They see everything in a particular framework, that this is white, this is black. Everybody should tell truth only. Nobody can lie. They take the term literally. Like, they are not able to see things in between. There may be white lies. There may be sometimes things which we do for according to social need. The ability to perceive that may be reduced. The person may say, okay, now you have lied, so you are wrong. So the inability to see the gray area in between can interfere in their perception of life and the way they understand life. And when that happens repeatedly, the decisions can be delayed. They only take decisions when everything is just perfect or everything is according to the textbook. Everybody should tell the truth. Like traffic. They can't go in traffic just like that because they are not following the rules. Now this person is not following the thing, I will not go in that particular road. So the inability to function because of the kind of the pattern thinking they have, that interferes their life. They can't go travel properly or probably progress properly or enjoy their achievement. They always feel worthless because it is not according to their definition of success. So this fixated thinking can interfere in the way they kind of choose things. So the way they work or the relationship, it can start interfering. So that is how the personality starts becoming a problem in their life. They're not able to see it other way. Or dependency. You are not able to take decision alone. You always want someone to tell yes, you are the right, you're doing right. Independently, they will not be able to say, okay, what I'm doing is right. They want some 10 people telling that, okay, now this is what you need to do. So it kind of becomes a disability that you are not able to have your own independent identity and you kind of depend too much on others. So that becomes a kind of emotional dependency, which kind of creates other problems for that person. So they do not have that clarity for themselves to not do without a validation. So that can become a problem as they move on. So if there is feeling of rejection, a feeling of fear of abandonment, a small change in a partner's behavior or anybody's behavior, they could take it in a wrong way. They can misinterpret it. So the way things are perceived can become very intense, and then they could take decisions which are interfering in their life. So the type of the issue they have starts interfering in their life, and this hampers their growth, especially in occupation and their relationship and their personal happiness. So that's how we have to identify that there may be a disorder.
So as I understood it, every personality is positive, negative, or every disorder is a negative. Am I right? So basically what I'm trying to, let me explain myself. So usually, generally, personalities can be positive, negative. I mean, it's just how you are, how you exist. Now, it becomes a disorder when it gets negative, or does it also get?
It becomes a disorder when your patterns interferes in your life.
Okay.
Like if you are a person who is a perfectionist, and if you are only liking things which is 100%, and you are not able to compromise at anything less than 100%, then it interferes in your choices you make. You would only go for a job which is like 100% according to your framework, or you would expect your partner to be 100%. So that is interfering. So it becomes negative only when it stops you from leading a normal life.
Okay, so let's say we have 10 people. So if we check all the 10 people, is there a chance that all the 10 people have disorders?
No.
They will all have 10 personalities.
Different types of
personalities. So is it like every personality is not a negative thing?
No.
It's not a negative thing. Only it becomes
a problem. If it becomes a problem, only if that is your pattern. Now, wherever I go, I'm suspecting everybody. Like I go somewhere and that person maybe have some other bad intention on me. So I'm not able to easily trust anybody. I am not able to easily make a decision. Then that becomes a problem for me.
Okay, one quick question before we go further on. Do you think this is very much related to the upbringing, the childhood, the parenting? Does it play a role?
It has a huge role. So genetically you are endowed with a particular personality. It has a genetic base, but the way you're nurtured, the early experiences what you have definitely has a huge role in the way you have become. your ability to be confident about yourself, the self-esteem what you have, the security what you have in your relationship, the attachment patterns what you develop, the way you kind of relate to others, the way you build relationships, the way you communicate, your ability to negotiate, ability to talk for yourself, being assertive, telling a no. All of that definitely comes from your early experiences, and definitely child has a big role to play.
Okay, I'm repeating myself. So a person having any of the personalities, does it mean it's okay? It's okay.
If that is not interfering their life and it is they are progressing because of their personality, that's nice. But if at all a person has an issue, is not able to trust people, then that is interfering in their life, right? So they have to change that.
No, for example, in the case of openness, for example, somebody is too much open, I think that is also going to create a problem.
Yes, if it is interfering, anything is interfering, that is going to create a problem.
Okay.
Whatever is creating a problem in your life, or it is a pattern, as I'm repeatedly saying, it should be a pattern in your life. You're doing this everywhere. And it is definitely going to expose you to more vulnerability, and then that's a problem.
So one very important question I think my audience would be also having, I think this will be striking them also. Can we treat this?
Personality disorder can be treated only if there is an awareness and acceptance and accountability by an individual. If a person have to change themselves, they have to be accountable for it. If they are not accountable, if they don't recognize their problem, or if they do not see their pattern as a problem, and they do not take ownership, they cannot change. If at all a person has a borderline personality disorder and they know they are impulsive, they know they are reacting, they know they have self-harm tendencies, they know it. Awareness does not automatically become acceptability. There is a journey from being aware to become accepting your problem to being accountable to your problem. The change can only happen when there's accountability and definitely support from the people around.
No, but there is a problem. See, if a person has an issue from the perspective of another person, but he doesn't accept it, he won't change.
He will not change. He will also create a problem to around people around.
So I think there the problem is not the real issue, is not the disorder. I think the real issue is not having the insight. So how do we work on that aspect of that?
See, either you learn it and be accountable it, or the nature is going to teach you anyways, because you're facing the consequences of it, right? So life will teach you. Like, if you don't change, the problem that you carry is going to bounce back at you. So
Exactly.
if you are somebody who's not trusting anybody, or you're impulsive all the time, you're going to pay the cost for it. Life will teach you. So either you learn it or wait for the life to teach you. It's like that. So you have to be accountable.
No, but how do we, for example, I am a father, so I would be kind of concerned about my kids, so they don't develop any of the issues. So as a father, how do I, be proactively thinking about kind of avoiding all these situations? What is there a checklist?
So I think it's more about the experiences a child would go through. And as parent, we can't be overprotective and give them a framework as to this is the way your personality should become. That may not work. So we should allow our children to experience life, maybe make mistakes. That's one way of looking at it. They kind of go through the process of the emotions, negotiations, the pain, the consequences. You could guide them, you could be a guide and a mentor, and then kind of so that they navigate through it. That's one way of looking at it. Or else giving them a mental preparation as to how things are, giving them a kind of orientation to things. That's another way of it. And another way is probably to expose them to reality and see how it works. So there are different ways. It's all through behavioral experiences and what we experience that makes us as persons, rather than just knowing some knowledge. It's not information, it's an experience. So the more we go through something, the more we learn.
So we have to let it go.
Let it happen. Then the more you experience something, the more you learn.
So throughout your journey, what was the worst or the best peculiar thing you would have seen with respect to the personality disorders?
So I have seen painfully how personality becomes a problem in most of the people's journey. However good the intention may be, if your actions do not reciprocate with the intention, the consequences are going to be bad. Most of the people with the disorder also have the right intent. If, let's say, a person with a borderline personality or a personality with an ungastric personality, they do have the right intent. They do want to do the right thing. They want to save the relationship. They want to achieve the best. They want to do the right thing. The intent is right. Nowhere the intention was a problem. The problem was the way the action was taken or the time they took to take those actions. So most of them have been hurt badly with the consequences, and some of them pay the price for the rest of their life with the consequences, with the loss of relationships or career growth or isolation, withdrawn or being judged or getting into substance use or brokenness in multiple aspects of their life. So personality disorder is extremely painful because the problem is you. The worst enemy to you is you at that point. So you cannot, nobody can come and save you from yourself. So that's where the accountability comes into picture. So if you do not become accountable and understand how you are harming yourself, and if you don't get that awareness and you don't stop yourself from harming yourself, nobody can actually save you.
Yeah. So I think off late there's been a lot of Bollywood actors who have been very vocal about it. They have come in, public space. They have talked about when they had taken extreme steps. Do you think this is kind of helping people to come out and kind of stop that taboo and overcome that stigma?
To some extent, yes. I think it resonated well with the younger crowd. They are able to kind of talk about their emotion more openly. But as I'm saying, talking about something is the beginning of things. Being accountable for yourself and your actions is what takes you far. So the more you become aware, the more you accept the painful journey in this entire mental health scenario is acceptance. It's not awareness. We all know at some point there's a problem, but the painful acceptance of our reality for the absent things in our life, our skills, our the deficit areas, it's not that easy. The more we understand our deficit areas, the more we understand what are we lacking, and graciously we accept it, then there is a road for recovery and there's a road for growth.
How painful is this acceptance journey?
Extremely painful, because you are understanding that there is it's like, how will you feel if you know you have cancer? How will you
First
feel?
Will be denial.
It will be denial. And it's not that easy with mental health issue, because most of the time you do not have an insight also. You don't even know this is a problem. So acceptance of it is extremely painful, lonely journey, because not many you cannot really share it with many people, because nobody is going to understand it, because they're not on the same page. So it's lonely, it's painful, but at the same time extremely empowering. If a person is going through a pattern behavior which is harming them, it's time for them to be accountable and accept it graciously, and that's where the self-transformation starts. That's where the development happens. So only acceptance leads to transformation and then the development.
Do you always need expert help for this, or you can do it yourself?
See, if you can't see your problem, you need a mirror. Somebody should show it to you that there's a problem. Many a times you don't know that there's a problem. You're all the time angry. Somebody catches you and gets you to the hospital, right? So you don't know you're angry. And sometimes you don't know why are you angry. So you may need help from a neutral person objectively looking at your behavior, like anger or suspicion or self-harm tendencies. You may need an evaluation. You may need a direction from a professional to understand how to navigate through this. But at the end, the journey is with you yourself. So you only have to do it. But then you will need a hand holding.
I have seen, some people, just because of this resistance, they don't want to go to the expert. I mean, one of the reasons is obviously stigma. And because of this, it's like the ship is sinking, the hole is getting deeper. And it comes to a point where it's too late.
Yeah.
So what is that first step wherein you have that need to go to the mirror, as you said?
When you start, sometimes when things happen, you yourself somewhere know that it's not right. When you see it's not syncing in with your ideas, you're not able to communicate effectively. You start feeling that people are not understanding me. People are kind of using terms like, oh, you're too reactive, you're too sensitive, you're too touchy, you're too paranoid. Nowadays, people are too vocal about labeling you. At least if that is happening in a pattern, I think it's better you go and find out whether it's an
Yeah, okay. So in your hospital, what are the major interventions you're doing for these kind of disorders?
First of all, a diagnosis. That's the most important thing, to see if you fall under a category of a disorder. So there's a huge difference between the way things go when you don't have a disorder, when you do have a disorder. So once we diagnose, then we have to prognosticate it to see what are the good prognosis factor in this and what the bad prognosis factor in this. So what is going to lead to success of the treatment, what is not going to lead to the failure of the treatment. So we need to kind of give a roadmap and then start the intervention. And the intervention first would be to build the insight and to take the accountability.
What is the journey period? How long does it take?
Personality disorder takes a longer time. So maybe 3 to 6 months to a lifetime. So because you are dealing with your personality for the rest of your life.
But it's treatable, right?
It is modifiable. It is transformable. You can kind of change, but then you remain what you are at the base of it.
That's the bad news.
Yeah, it is. You remain what you are. I mean,
so it's just that we manage the disorder.
You modify. You kind of understand, oh, this is my way of looking at it. This is my pattern of thinking. So I need to be aware of the possibility that I may end up doing this. So I take in charge of not taking decision based on what I feel, but what is the fact. Being objective about situations leads to more success.
For the benefit of the audience, is there any tool, or you don't recommend going for a software tool wherein you can check?
Do you have a person? Yeah, you could do that. It kind of give you briefly an idea where do you fall. But I think they have made it extremely minimalize the problem. So it seems as if it's a very simple problem. You could get yourself tested, but if you see there's a problem, it's always better you kind of meet somebody.
Which is the worst ever disorder, personality disorder?
It's a wrong question. So in the sense that everything is, whoever suffers, that's bad for them.
No, but I think nowadays in social media, there's been a lot of animosity towards narcissism.
Yes. So, narcissism has a lot of angle to it, and I think it's misread a lot of times.
Now, for the audience, first let's explain what is narcissism.
Narcissism would be excessive self-indulgence and to be completely preoccupied with your own self and your preferences, disregarding someone else.
Only thinking about oneself.
Okay. And kind of manipulating everything for yourself.
Is it the extreme selfishness?
No, it's a very simple way of putting it, but it is not. It has a different tangent from being selfish also. I think it requires another discussion altogether.
Do you think it takes 1 hour or a separate podcast for narcissism?
Yes. At least for in today's Instagram world, we need to. Toxicity and all of these terms are being used very loosely, which probably is not very healthy.
Okay. It was nice talking to you. Thank you so much for your insights.
Welcome.
Thanks for watching the podcast. Thanks to our main sponsor, Mind and Brain Hospital. We'll see you next time. Stay blessed.